Well, welcome, Dr. Joseph Coyle. We are so glad to have you gracing our website with your insights in what it's like to be a Catholic psychologist. Would you like to just jump in, or can I give you some other questions?
Sure, I'm happy to jump in. Thanks for having me. Appreciate it. Appreciate the opportunity. And I'm a Catholic psychologist and historically had two offices, one in Waltham and one in Norwell in Massachusetts here. And currently, and since the pandemic, I'm doing everything remotely. And I'll have plans to be back in person at some point. But for now, everything's remote in this new world we're living in here. So stand with that. Um, I love my work, and it's an absolute privilege to work with people and to offer them the opportunity to incorporate their faith as they're wanting to do that. And I think Dr. Murphy and myself have both found that in this area of New England, there's a real demand by people for um, this type of work. And it can be hard to find faith-based practitioners. A lot of times people will contact me and say they've been struggling for a long time to find people. Sometimes they don't always identify, with their faith perspective right out there. But it's important, I think, to have that be an opportunity for people that want to incorporate that into their therapy. And so I do everything that a clinical psychologist does. I'm a licensed clinical psychologist in Massachusetts. I work with adults, really a generalist as far as I consider myself. I see everything under the sun, really. Depression, anxiety, loss and grief, a lot of couples and marital work, some trauma, some OCD, some addictions, so really everything under the sun that you would do with adults. And I offer people the opportunity to incorporate their faith perspective into the work as they feel comfortable doing that. And again, I found people are really kind of surprisingly clamoring for this. I've had the experience of people, really willing to travel great distances to work with faith-based practitioners. And I've also found people really vary as far as what they're wanting or looking for when they think of Catholic psychologists or Christian psychologists. So certainly the initial contacts for me are really geared towards, number one, understanding what the issues are and what help they're wanting, but also what that means to them and what their expectations are, what they're wanting. Some people are really very much wanting to incorporate talking about scriptures, incorporate praying into the work, really, really talking about the Lord in their life and how that might pertain to things they're experiencing. Some people aren't wanting that. They're just wanting to know that we're on the same page as far as our worldviews. All that is fine. And I kind of try to say to people, I don't have any more spiritual authority than you do. I'm a baptized Catholic, and so there's a certain amount of authority that comes with that. But we're kind of on the same plane as far as that goes. But I'm happy to talk about things as people are wanting to do that and comfortable doing that. Really feel like it's an extension of the multicultural component within psychology, within psychotherapy, that's increasingly been incorporated as it should be. And people's religious framework are part of that, in addition to their cultural framework, racial, ethnic framework, all different aspects of the person being incorporated in there. And so when someone identifies as a Christian and having God, Jesus as the center of their life, at the very least, you do a disservice to them and to any kind of rapport that you might build if you tell them they can't talk about that or they can't fold that into their treatment.
Can I jump
So
in? This
yeah,
is reminding me of what you went through when you started out, because when you started out 10 or 15 years ago, you actually had to consult with lawyers, and it was really not an easy thing to do. Can you talk at all about why you have to be so careful with the stuff you were just talking about?
sure. Yeah, it's important. Psychology has very clear and careful ethical guidelines because the nature of the therapeutic relationship inherently has a power differential to it. And so, um, that the therapist, the psychologist would be seen as the expert. And so on human behavior and psychological issues. So you have to be careful that you're not pushing your views, and certainly your religious perspective on people if that's not seen as part of the expected aspect of the framework. We're here for therapy, we're here for psychology. I'm licensed as a psychologist, and so there's kind of duties to God and Caesar here that you have to make sure that you're staying within your areas of competency. But again, also wanting to meet the client where they're at and wanting to be able to get to the bottom of issues and to be able to incorporate their framework in there. So definitely, I started my practice in 2005, and it was a little bit of a different landscape there, particularly in New England, where alternative methods, which at the time, incorporating prayer or spiritual practice would be seen as an alternative method. Probably would be to some extent now, but there's been more of a precedent for that. There's the Association of Christian Counselors, which is tens of thousands of members. There's also Association of Catholic Therapists, which is also a known organization. So there's been more and more of that precedent set, and really an establishment of Christian therapy as a bona fide modality. Even as far as insurance companies go, it's one of the things that you can identify with as a subspecialty. So more and more recognition and more normative to be doing that. So again, I think you want to always go ahead.
Just for the record, when you started out, there was a worry that if a client asked you to pray with them and you did, following their lead, there was still some worry that that would be considered malpractice or something. So you had to begin very carefully. And I think, as you just said, 17 years has gone by or whatever. So how do you feel that has worked out?
Well, I remember when I was doing my postdoc hours at a great community mental health center, I was kind of struck by in some ways, the level of need and just the issues that people had, and that one after the other they were mentioning God, and this was something where I was really sitting on my hands, and this was a secular position and organization, and I was kind of like, can we talk about this, because it really seemed to be at the heart of their struggles and also at the heart of what would help them. So there was, kind of trying to find anybody that I could find, either within the professional context or the legal context, on what the parameters were around that. And so, the feedback really was, you have to take the client's lead, and also it's important on how you frame what you're doing, which is, part of the reason why I'm very upfront with it and out there with it. So in some ways, people know what they're getting, and can find, someone that has this perspective. So I think there's been a great progression, certainly in my work, of being able to do that and feel comfortable doing that and confident doing that. Again, taking the client's lead and taking them where they're at, and really having that conversation with them about what they're looking for and wanting on those levels.
And I think by now you've seen hundreds, if not 1,000. How many clients
Yeah,
have
I
you
think
seen?
I'm over 1,000 at this point. Just
Wow.
just within COVID, I've I broke the 1,000 barrier, if I'm not mistaken. Yeah, it's just amazing. Yeah.
And I wonder, you've been doing a good job of giving us the background of your work. Can you give us an example of how you combine the Catholic faith with regular clinical psychology?
Sure. Yeah. I think I break it down into two parts. And one would be when you talk about the things that bring people in, we think a lot of times in terms of symptoms and classifications and so forth. And some of those classifications do a disservice to the variety of presentations that people can have. But if you think of anxiety or depression generally as some of the most common things that would bring people in, and you want to try to get to the bottom of it. I think I try to have a balance on really the structured approaches that would be more here and now and more maybe behavioral versus the more depth oriented psychologies that would delve deeper into the emotions and into the childhood and so forth. But very often people, again, when they identify with a strong Christian perspective, the roots of the issues many times deal within that area. And so, for example, a root of depression, as you delve into these deeper areas in the emotions, sometimes you find people have a sense of anger towards God that is at the heart of their depression, or a difficulty with discernment and feeling really lost or unable to understand what God's doing in their life, where God is, or what they're asking him for. And that this often can be the heart of the depression. Similarly with anxiety, a lot of times when you delve into these areas, you find a lack of trust in God at the heart of some of these issues with anxiety. Even if you look at the scriptures talking about peace and talking about not to have a spirit of fear, and people can say they can recite those scriptures better than I can, but there's an aspect of, on an emotional level, they don't really believe. And I think this is something for all of us. We have a hard time believing that God really has our back and really is not going to let us fall. And so again, when you get to the heart of the matter, sometimes the roots of the issues go a little bit deeper than secular psychology would let you go. Okay. So that would be one side of it as far as getting to the bottom of things. The other side would be incorporating all of the assets that you can leverage from the person's faith perspective. And so I'm a Catholic therapist, but there's Christian, non-denominational, Protestant denominational folks that I see and that are wanting a Christian therapist. So understanding and leveraging their own framework, their own prayer life, their own understanding of scriptures, their own understanding of prayer, and sometimes, for example, within charismatic or Pentecostal threads around healing and praying for healing and wanting that, going to different services and masses. So really trying to help them bolster all of the resources that they have within their practices, but also within their own belief system. I think one of the things I'm kind of struck by, or that I sometimes see my role, is helping people apply their own beliefs to the psychological situations. Because I think all too often there's this feeling that, well, this is, I have my spirituality over here, but this is a psychological issue, and it's kind of trying to say, well, wait a minute, the psychological is subservient to the spiritual, and God is sovereign over all of this, and we're trying to be mind, body, spirit as far as the beings that we are. So just trying to help people apply what they already believe to these struggles, and to use those in a way that really helps resolve the issues that might bring them in.
Can you give any examples of cases that the method has worked really well for? I mean, a particular case where there was a breakthrough that could only occur because of the Catholic therapy, or anything like that? Does anything come to mind?
Well, I think I might clump it into some general kinds of things that one of the biggest uh, benefits or just kind of impacts on me is when people can talk about that they reconnect somehow with their faith that resolves, let's say, a sense of depression. I think when people really plug back into their, let's say for Catholics, the sacraments, plug back into prayer life, really to see things move. And again, I think we try to operate saying it's our job to be doing the inventory on our side and trusting the Lord to show up and do his work there. So certainly things like depression, in a number of cases, when people can plug back into that sense and reignite the pilot light that's gone out for whatever reason, or they haven't really been feeding in a lot of ways, when they can do that, they see things shift. Similarly, in cases where people are having this kind of obsessive kinds of anxiety and having things that are ritualistic or things that are patterns in their life are really built around the anxiety, again, almost doing this kind of cognitive therapy within their framework of their belief system, because very often, we're more Old Testament and thinking of the harsh, punitive God, and we're lacking the mercy, so I think pulling people back into that sense of Jesus and the mercy there, and how that pertains, and why is their default to internalize this harsh, punishing view of God in relationship with God versus the more merciful side of the Lord. So again, when there is that openness to doing that, people can find that these fears and these kinds of obsessions can really subside. I think that's something I found also around anger too. When people can allow their anger, a lot of times as Christians, I think many of us feel we're not allowed to ever be angry, and we have to split that off into something else, and we don't incorporate that into our personality in a healthy, appropriate way. And so a lot of times the things that we would see as symptoms of disorders can come down to that, and helping them to bring that back in, and again pointing to, look, every main character of the Bible is somehow arguing with the Lord, and even Israel means the people that wrestle with God. So just giving that a voice and a space is often very, very helpful and healing for people, in that way, I found. So those are some ideas, on that.
No, that's great, Joe. And if you could, one of the premises of the website is Catholic mental health resources, is that there are other things besides therapy. So to turn to you as kind of an expert in human development or recovery outside of the counseling relationship, are there other things that you've found or that people have told you about that also have psychological benefits?
I think another thing I can add, is that, for example, and this might piggyback on the last question too, something like depression. A lot of times I find something that gets missed when you're looking at the roots is, number one, someone who is a creative person that is not doing their art. And as Christians, I think it's important that we come down philosophically on, we believe there's a blueprint to the person that's God-given, right? And that it's our job to understand what that is, excavate that. A lot of times creativity, if it's ingrained into that and you're not doing it, it doesn't leave you alone, and it kind of turns around and can strangle you in a sense. I think creative people can talk about that experience. So that would be one thing that comes to mind on just the creative pursuit and just general areas for doing that and how you incorporate that in. I think a lot of times, even culturally, we say, well, that would be nice if you have time for that or can do that. Whereas for many people, depending on the personality and the person, it's vital that you do that. So that would be one that comes to mind there. I think another thing similarly to that would be some people that would gravitate towards a Christian counselor often have what seems to be a call to ministry that they're not listening to. They're running from it, and they're, kind of saying, I don't know, either they don't feel worthy, or they feel they would have to give something up. They'd have to give something of their self up in order to do it. But that can often be at the heart of things. So just any of the ways that we as Christians are in community and in ministry, and the roles that we can serve in there can absolutely, very much inform and sometimes be the solution to a lot of the things. Something like spiritual direction is very much something that people are either already engaged in, or they've engaged in it, or that we would, say, let's try to have a scenario, or look, we're doing Christian therapy on this side. But again, that's another thing on the bounds. I'm not a spiritual director, and I don't have the training and expertise there, but to plug into a priest or someone else, pastor, that would do spiritual direction, that could be coming at it more from the spiritual side, less from the clinical side, but that those would inform and kind of feed off each other very well. I can think of many cases where that's been true. So, those are some things. There are a lot of good ministries and a lot of good churches, and it's important for, again, to understand the importance of that for people that are already connected to those places, and also to suggest or talk with people about their own search for those, if they're not connected as part of their process.
Well, Joe, this has been really instructive and uplifting, and I wonder if we can close with anything that you found particularly inspiring yourself. Any people, anything in the world to give people hope, or that gives you hope?
Absolutely. I first should say I'm inspired by my clients every day, not to sound too much like a Hallmark card here, but that put me to shame every day with their great strength and faith and so forth. And always it's this feeling of getting more than you give in a role like this. I love the saints, and I'm always drawing strength from the saints and readings from the saints. Mother Teresa is a big favorite of mine, and Saint Francis, are two big ones. I think Mother Teresa, just the humility there, and the number of quotes that she has. I love it when she says, the Lord never forces himself on anyone. That's the best part of God, that he's almighty, but he doesn't crack through and force himself on anyone. And that really speaks to the role of the person's will in their own healing and their own therapy, which is the mystery of God limiting himself by our will. And I think that's very important, that we come up against that in therapy very, very often. You're really limited by what the person is willing to do, so that's one for Mother Teresa. She also had, just a beautiful sense of the smallness of what she was doing, even though she was, operating on this grand scale. But really saying, people used to say to her, don't you feel discouraged that, you're doing what India should be doing, or, the political system? And she said, I don't really think about it that way. I can only help one person at a time. And really what I do, it's just a drop in the ocean, but if I didn't do it, it would be one thing less. So just that, I think that's something I think of all the time with all the issues in the world, certainly at this point in time, and all the things going on, that you help one person at a time and focus there, that, again, trusting that the Lord is going to take that and use that, and, for his will and his glory.
Well, I think that's a perfect way for us to end, because I know from hearing from many of your clients that you have helped many individuals one at a time to find their call, to find their inner creativity, to find peace of mind. And so I'm really grateful to you for making the time for us. I know it's a long day for you, so I'm sure you want to get back to your family. But Joe, we can't thank you enough for coming, and we wish you continued good luck in your wonderful ministry.
Thank you so much. Thanks for having me, and every blessing to you. Thanks so much.
Take care.